Hello, and welcome to the guideline for enrolling into a healthcare plan on healthcare.gov, brought to you by the Insurance Port. My name is Desiree Furman, and I will be helping you go through the application on healthcare.gov's website. Just keep in mind that the application may seem different for different users, but this is just a basic overview on how to complete the application. We will put our information inside of the links below in order for you to contact us if you would like to have some answers to your questions that you may have that are more personal. Okay, so to get started, of course, you want to make sure you are on the healthcare.gov website. And you can get there by typing in www.healthcare.gov, and it will bring you to the main website here. Now, there are two ways to get started depending on what type of user you are. If you are a new user, you're going to select here where it says to get started in the middle of the page. If you are a returning user, if you've had an application last year, you're going to go to log in here and it will take you directly to the login page. But for all purposes, I'm going to make sure to go ahead and get started here. You're going to select the state you're in. I'm in Florida, so I'm selecting Florida and click Apply Now. And the next page is going to be create an account. In order for you to create an account, you need to make sure you fill out all this information here. So you want to type in your first, the last name. This is our email address if you have any questions for us. If you want to select this is optional if you want to receive news and updates. And this is where you'll select the password. Remember, it's very important to write this down. But the password needs to be 8 to 20 characters, upper and lowercase letters, and numbers. So for an example, you'll see once I type in a password, it has all these green checks, which means my password meets the requirements. And then you'll retype it for verification purposes, and you'll see as we go along, these little green checks means that it met the requirements. Here you're going to select pick a question. These are your security questions. If you ever forget your password, they'll ask you these questions to verify your identity. So pick whatever you know that you remember. Again, important to remember this. And the reason I stress that is because if you forget this, you will have to call the marketplace. And as you know, and everyone else knows, calling the marketplace can take some time because they do experience high call volumes, which can result in a long wait on the phone. So just make sure you write this down, put it in a safe place, your security questions and your password. So the following year, whenever you are updating your application again, which I strongly suggest everyone to do, because plans change, your information may change, you have this information available. Once you're complete, you're going to select I understand and I agree with the privacy policy, and there's a hyperlink for you to view the privacy policy and create an account. What will happen once you create the account, you'll see at the very bottom a message will pop up that says you have been sent a link to your email account. Please go check your email account for the link to verify your email address. I'm not going to fill this information out because I already have an account available. So once you go to your email account, you'll see a message very similar to this from healthcare.gov where it's saying that your marketplace account has been created and there's only one step left. So make sure you click on this link here. And once you click on the link, it will then take you into back, which is the login page here. And you'll put in your username and password and log in. And once you log in, it's going to bring you up to a website that looks very similar to this. Or if you're a new user, it's going to ask you to verify the terms and conditions for the healthcare.gov website before, and then it will transition you to this web page here. So as you can see, you'll have your name here, and you'll have welcome my profile, where in the future you'll be able to access your previous application and any messages from the marketplace. So when you're ready to go, we're gonna go ahead and visit the marketplace for individuals and families. Do you want to start a new application? Select yes. You're gonna select the state you're in again, Florida, and hit next. Alright, so this is just letting you know you can apply for any of these people on the same application, even if they already have health insurance. Yourself, family members, anyone on your federal income tax return, such as any dependents. Here, important, you may need names, birth dates, and income information for your family. So if you're including any dependents, you will need this information in order for you to complete the application. And social security numbers as well for these individuals. And then hit next. And be patient because sometimes it can take a little long on the marketplace for it to go to the next page because there could be a lot of users on the webpage trying to access the application. Okay, so it's taking a little long, so I'm going to go ahead and pause and then I'll come right back to you guys once it has updated. Okay, sorry about that. It took a little while, but it did finally go to the next page and it says your identity has been verified. Now this is for someone that has already verified their identity. If this is the first time that you filled out an application, you will get a web link or web page that will ask for your information as it appears on your legal documents. So it's going to ask for your first, your last name, your address that's also within your driver's license, and your social security number. And then it will take you to the next page once you have verified that information. Okay, so again, like I told you, some applications may look different than others, but the information is pretty much the same. So just try to bear with me. If you have any questions, again, you can contact us directly for more information. Okay, so here it's going to ask about household. Are you single or married? So you can put married here, or you can go ahead and put single. How many tax dependents, like your children, will you claim on your 2015 tax return? Include all your dependents on 2015 tax returns, even though those not applying for coverage. So, for instance, some children may already have Medicaid, they may have another form of Healthy Kids or any form of insurance that they already covered, but you still want to include them as your dependents on the application, as well as any other dependents you may have as well, such as a grandmother, maybe she has Medicare insurance, etc. So for all purposes, I'm just going to put 2 here to include a family. If you don't have any, you'll put 0. It's asking how much income are you making this year? And it's optional, but go ahead and answer it because you're going to have to answer this question later on. And based on your estimated household income in 2015 of less than 100, may you get help paying for coverage? Do you want to answer additional questions? Answer yes. You want to answer additional questions because you may be eligible for additional assistance from the government. So that means for you lower premiums, lower deductibles, lower co-payments. So it's always good to go ahead and put this question yes, unless you know you make or earn a significant amount of money where you won't qualify, then you don't have to put it. Okay, so here you're going to answer some yes or no questions. Does everyone applying for coverage have the same permanent home address and currently living in Florida? Is everyone applying for coverage a U.S. citizen? If you're not a U.S. citizen, you want to make sure to have your paperwork ready, whether it's your resident card, your immigration status, and also your certificate of citizenship, because it is going to ask you more information about your certificate and etc. to put on the application. You will need the numbers. Can you enter the social security number? Is everyone applying for coverage? Is everyone who's applying for coverage claim has tax dependents on your federal tax return other than yourself and your spouse? And are all of these dependents your children who are 25 and younger and single, not married? Are any of these dependents your stepchildren? Is anyone applying for coverage currently incarcerated? Is anyone applying coverage American Indian or Alaska Native? Is anyone applying naturalized or derived citizen? Is anyone applying for coverage under a different name than on their social security card? An example of this is you may have someone that has two last names, or someone who just recently changed their name through marriage, through a divorce. This is why that information is there. Is anyone applying for coverage pregnant, or have they had a child in the last 60 days? Is anyone applying for coverage eligible for health coverage through their job, someone else's job, or COBRA? So COBRA, a lot of you may be familiar if you're at a job and then you recently are no longer working there for a certain amount of time, which is usually around 60 days, you can have COBRA insurance that you're paying for. And if you do have that, you will select yes there. Is anyone applying for coverage of full-time student, going through college, any of your dependents? Was anyone in foster care? Are you and your spouse responsible for a child 18 or younger who lives with you but isn't on your tax return? Do any of your dependents live with a parent who's not on your tax return? So again, everyone has different scenarios, so make sure to answer the questions that are particular to yourself. Okay, so here you're going to continue on with the information with household contact information, and you're going to put in the first name, last name, email address. You can put in a phone number here. I'm just going to put in a fictitious number, and your preferred written language and spoken language. So this here says go paperless. Get your notices by email instead of paper copies in your mailbox. If you're someone who prefers to get your information from the marketplace, notifications, any news, then you can get that via email. You'll select here. But if you're not, then you want to uncheck this and you'll have paper copies that come to your mailbox. So depending on the person you are. And another person is helping me complete my application. If you are located in the state of Florida, and the state of Florida only, I would ask you to please click here so that you can put my information. It has a licensed broker that I'm assisting you and guiding you through the application. And you can go ahead and put my first name, Desiree, my last name, Furman. And here you're going to select agent or broker. And here you're going to put D Furman. And MPN number is 173-29919. Again, 173-29919. If you're not in the state of Florida, you can go ahead and uncheck this. I'm just licensed in the state of Florida for insurance, so that's why I will tell you you don't have to check mark that. But I still appreciate you tuning into our YouTube video to find out how to complete the application. So here you're going to put an address. So I'm just going to make up an address here. Is your mailing address the same as your permanent address? You may select no here if you have a P.O. box, but if you don't, go ahead and select yes. And if your name on your social security card is different than the name below, update it here so that the name appears on your social security card. This is very important, so make sure that your name is the same as it appears on your social security card. So if you have two last names, make sure you put two last names here. And also middle name as well. So you can go ahead and put the date of birth and a social security number here. Okay. And you can select ethnicity. It's optional. You don't have to select this if you don't want to. And here's the spouse information. So I'm just going to put this out. And put the date here. 1950s couple. And again, that's optional. Are you applying for coverage for this person? Yes. If your spouse already has insurance, you can select no here because they don't need coverage. But if they do need coverage, select yes. So now we're going to go into the dependent information as well. So this is anyone you claim has a dependent on your taxes. So a son or a daughter or a grandmother, a niece. And then the last person here. Yeah, I'm just putting fictitious information, so we can go on with the rest of the application. Okay, so it's now loading and should take you to the next page. Again, be patient because the web page can be a little slow. Okay, great. So now it's asking for current income for Danny, which is the first person here. And it gives you some information, some ideas of what to include. So people can get income in many ways. We need to know about your income so we can figure it out. If you can get help for paying for coverage. So how are you getting income? Is it Social Security, alimony, scholarship, job, other, rental properties, retirement, a pension? So you're going to add new source of income and you're going to select what kind of income are you receiving. And then you're going to put a job, and then here you're going to tell us about the job. So you need your employer's name. So I'll put that here. Publix. You need the phone number and the amount. So as you can see here, how often, if you earn a yearly income, you can have per year. If it's per month, twice a month, every 2 weeks, because you're someone that may have income that changes every 2 weeks, per week, per day, per hour, however you would like to put the information in there. And I'll go ahead and put 30,000 per year. And this is optional. This is if you want to put the employer identification number. If you have this available, I would go ahead and put it because it would give the street address. If not, you will need to, of course, put the information for the street address. And hit save, and you'll see that there. So if you need to edit it, you can edit or remove. Does Denny have any deductions for 2015? So if you select yes, just so that you can see what kind of deductions it may be talking about. Or are you doing alimony? Do you have a student loan that you're paying on? Maybe there's other deductions that you can claim as well that you'll be able to put in there. If you don't have any additional deductions, go ahead and select no. And so here it's just going to verify based on what you entered, his income minus any deductions will be about 30,000. So what this calculator will do will take how much yearly income he has and subtract any deductions that he may have, and then it'll put a total here, but we didn't put any deductions. So we're going to go ahead and just select Yeah, so it's the same. And now it's asking income for myself, the spouse. Is there any income that she is bringing in? So I'm going to put here. Um, and so you just put in the information. I have to put in this information, so let me go to the next page so I don't need to take up time here. So again, it's just verifying the amount of money, and this is for the dependent. Is there any income for a child? And it could be someone, if this was a dependent in college, of course, this is where you would add that type of information. Or if you had another dependent, like your grandmother or anyone else you claim on your taxes, maybe they have a pension, you would add this information here. And but I'm going to put 0 because I'm going to put that it's child, so they're not having any income, and it just verifies that this person's not making any income. And then again, for the second child, there's no income, so I'm going to just verify that that's correct. Okay, so now we're at additional questions. You're almost done. I do want to tell you here the application ID, where this would come in handy is if you ever need to call the marketplace in order for you to make updates to your application. Maybe in the middle of the year your income's changed, you got married, you got a divorce, you got pregnant. Any of those type of income changes, you can call in, and they usually ask for the application ID number, and that's where you can find that information. And so now it's just asking any questions about physical disability or mental health condition that limits the ability to work or attend school. I'm going to select nobody. Again, this is if they need help with daily activities or live in a medical city. This is optional. And the next question is also optional, but it's asking, does any of these people need help paying their medical bills from the last 3 months? So now it's asking me, is Denny currently enrolled in a healthcare coverage? If he is, you would want to select yes here, so they don't give you information also for him for a premium amount, because they'll include him in the premium or the plan information if you select no. Again, I'm going to select no because I want to get coverage for my entire family. And the last question, of course, did anyone lose coverage within the last 2 months? The reason they ask this question is because that would give you a special election period to choose insurance. Anytime you have an insurance plan, if you were through a job and you no longer work there, you have within 60 days to get a new insurance plan, and it gives you a special election period to be able to choose insurance. Otherwise, for the rest of the year, you're not able to do that. Does a child in this application have a parent living outside the home? So this is a question that you can ask if there's parents that are separated. Were any of these people found not eligible for either Medicaid or CHIP, which is for Children's Health, after November 15th? If you have never applied for Medicaid or CHIP, this does not apply to you. This is only for someone who has applied for Medicaid or CHIP and they received a letter from the government stating that they are not eligible or lost coverage because of their income. And these are just additional questions about life changes. Did anyone lose coverage? Will anyone listed below lose coverage? Has anyone gotten married? Released from incarceration? Did anyone gain eligible immigration status? Was anyone adopted, placed for adoption? Does anyone listed below move on or after? Now, this is important. I have a lot of clients ask me what this means as well. When you move to a different county, a different state, you also will be able to get a special election period because the plans are different in each county, zip code, and state. So in order for you to be able to get the best plan for you and to ensure that your insurance is going to cover you in a different city, because Humana may not be in Boston or any states like that, it allows you to go back into the marketplace and choose a new plan. And here you just want to make sure that you agree to the marketplace. Okay, so now it's the summary. So you want to go through and verify the information. I know it's a little bit of a headache, but you just want to make sure your information is put in correctly so that it does not give you the wrong information at the very end when it's giving you the eligibility for any assistance. So agree and confirm if anyone's application enrolls in Medicaid. They're giving the agency rights to pursue and get any money for other health insurance. Just make sure that if you are on Medicaid or if you're receiving any help, that you are keeping up with the Medicaid with any changes in income. And I know I must tell the program I'm enrolled if any information I listen out, the application changes. So when I was going over with you earlier, if you move, if you get a divorce, if you get married, if you have a baby, if you get pregnant, any of those type of changes, and you can find more information on healthcare.gov about other situations, you want to make sure that you are calling the marketplace and updating that information so that they can make sure that your information in the plan that you are receiving is the right one. And sign and submit. I'm signing under perjury that this is the information provided to these questions are to the best of my knowledge. And you will type in your full name below to sign electronically. And once you're complete, you'll submit the application. Okay, so I'm not going to submit the application only because the information that I put in is fictitious, so I don't want to say that that information is correct. But once you come to the next page, you're going to have a letter, and it's going to be an eligibility application letter. And I want you to open that up, and I want you to review that information. And what's going to be in that letter is going to tell you if you qualify for any assistance, you may have a tax credit amount that you're eligible for. Something similar to this that it might say. It may say that you're eligible for a cost sharing reduction as well to lower your co-payments, your deductibles, your monthly premiums, or you may not be eligible based on the information. And so you want to make sure you review that letter and save it to your computer or print it wherever you feel like is a safe place to keep it. And a little bit lower in that letter, you also want to pay attention. Sometimes the marketplace does ask for you to send in proof of your passport or social security card to verify your information. And you have by a certain date, which I've seen a lot is March, to turn in that information. So it's very important for you to read over that letter. Now, once you read over that letter, you're going to have the opportunity to go select a plan. So in order for you to select a plan, you're going to want to continue to select the plan. And then you're going to have another page where it's going to have a different additional information for you to also complete. So it's going to have you verify your information again, like household information, basic questions. And then you'll also see where it will ask you for any dental options or if you want to continue on to the next plan. And once you go to the next page, there's going to be also a page that's going to ask if you're eligible for any tax credits. If you want to go ahead and use your tax credits now, you can use all of it, some of it, or none of it, and later on receive that money in your tax return. So you do have that option, and we'll explain that to you. But once you continue on to that page, it will bring you up to plans, and you'll see we'll have bronze, silver, gold, and platinum. And it will be similar to this page, but it may look a little different. I'm just going to explain briefly what the difference is so you have an idea and you're a little bit more informed on making a decision that's better for you. So as you can see here, The bronze plans are going to be the plans that are going to be the least amount of money, depending if you're eligible for tax credit or not. If you are receiving tax credits, you may see that the plans are going to be lower for you. But one thing I want you to keep in mind is if you are receiving, here we go. If you are receiving cost sharing, you have to select a silver plan. Again, if you are eligible for cost sharing, you will have to select a silver plan. It is only applied on a silver plan. So you will want to make sure that you click on silver plans to see what plans are available for you. Now, depending on the type of person you are, if you want a plan that's going to cover more of your costs, then you're going to select the platinum plan. But again, those plans are going to be higher. The premium amount is going to be higher. If you want a plan that's a little bit less, you can select the gold, the silver plan, which are pretty popular, especially if you're receiving tax credit or cost sharing. And the bronze plans are going to be the least expensive plans for individuals that may not be eligible for the cost sharing. So as you can see here, just a brief overview. You have a Humana Bronze plan. It has the name of the plan, and it will give you the monthly premium, how much it's going to cost for 4 people. And it will tell you premium before tax credit. So it's $841 before, but it's showing a lower amount because on the previous page, it showed that this particular family was eligible for a tax credit of around $700. So again, everyone is different, but this is just an example that I'm using. You'll have your estimated deductible, which means you have to meet this deductible before the plan starts covering for certain services. So as you can see, for primary, you have to meet the deductible, but there'll be no charge. Specialist, emergency room care, no charge after deductible. Generic, no charge after deductible. And this is just this plan. There are plans that have a deductible, but you can see a primary doctor or specialist with the copay, $10 or $15, without meeting the deductible. So again, this is just a brief overview. Here it will give an estimated out-of-pocket maximum, which means to you for the year, if you pay out of your pocket, if you go to the emergency room per se, and you pay out of your pocket $12,600, then for the rest of the year, you will not have to pay anything out of your pocket. So again, the maximum out of pocket means once you have paid this amount out of pocket, you will not have to pay anything out of pocket for the rest of the year. So you can click onto these plans. You can select here if maybe you want to see this plan, and you can compare them. As you can see, it will let you know what to compare. But if you also just want to see what the plan will cover, you can also go here, and it will go into a lot more detail about prescription drugs, hospital services, dental care, child care, medical management, and all that information. And just to give you a quick idea about a silver plan, this is just what the silver plans look like. As I told you, the monthly premium will go up as you go to different plans, and deductible will go down, and the estimated out-of-pocket maximum will go down. But as you can see here, the primary is 25, specialist is 35, but you don't have to meet the deductible here before you go to see the primary or specialist. So these are things that you should keep in mind while you choose a plan. Depending on if you're looking for something less expensive or you're looking for better coverage. Also here it goes over PPO, HMO, and EPO plans. If you want more information, you can definitely go to healthcare.gov, and it does tell you what the difference is with an HMO plan. HMO plans, generally you have to stay in network with doctors. If you go out of network, then the insurance plan is not responsible for covering. A PPO plan, it's a little bit more expensive sometimes. However, you can go to any doctor. It doesn't have to be within a network as long as they're participating providers for insurance. So there's more information about that as well on healthcare.gov website. And I think that's all. If you guys have any questions, please feel free to email us at info@theinsuranceport.com. Again, info at theinsuranceport.com. Or please feel free to also call me directly at 407 655 9117. Again, 407 655 9117, and I can try to answer any of your questions for you that you have. Also, feel free to visit our website at the Health Insurance Port, or you can go to theinsuranceport.com as well, and you can see our page here. It has frequently asked questions homepage. It has a video to learn a little bit more about healthcare.gov and how it works. It has a countdown for you to make sure you enroll on time, some testimonials, and also like our Facebook page, The Insurance Port. So make sure to find us on Facebook and like our page. We do put out articles of what's currently going on in the market with the insurance to keep you updated. So thank you for listening. And again, thank you if you live in the state of Florida for putting me on your application, for helping me and my family. We greatly appreciate it. Again, my NPN number is 173-299-19. I hope everybody has a great year and a healthy one. And feel free to give me a call with any questions. Have a great day.